Welcome back to Click Future, where your future is a click away. Today we're exploring how quantum computers are revolutionizing medicine and healthcare, enabling treatments and cures for diseases that have plagued humanity for millennia. We're not talking about incremental improvements in existing treatments. We're talking about quantum-designed therapies that can cure cancer, reverse aging, and treat genetic diseases at the molecular level. Quantum medicine is transforming every aspect of healthcare, from drug discovery and personalized treatment to diagnostic imaging and surgical precision. Diseases that were considered incurable just years ago are now being treated successfully using quantum-enhanced therapies designed specifically for individual patients. The implications are staggering. Quantum computers can model biological systems at the molecular level, enabling the design of drugs that target specific disease mechanisms with unprecedented precision. This is leading to treatments that are more effective, have fewer side effects, and can be customized for each patient's unique genetic makeup. Neil deGrasse Tyson has observed that quantum medicine represents the convergence of physics and biology at the most fundamental level. We're using quantum computers to understand and manipulate the quantum mechanical processes that govern life itself, creating opportunities to heal that transcend the limitations of traditional medicine. Today, we'll explore how quantum computers are accelerating drug discovery, enabling personalized medicine, revolutionizing medical imaging, and bringing us closer to conquering humanity's greatest health challenges. Traditional medicine has always been limited by our incomplete understanding of biological systems and the trial-and-error nature of drug development. Developing a new drug typically takes 10 to 15 years and costs over $1 billion with a 90% failure rate. Most drugs that work in laboratory studies fail in human trials because biological systems are far more complex than our models can capture. The human body operates as a quantum mechanical system at the molecular level, where proteins fold according to quantum principles, enzymes catalyze reactions through quantum tunneling, and cellular processes depend on quantum coherence effects. Traditional computers can only approximate these quantum biological processes, missing crucial details that determine how treatments will actually work in living systems. Personalized medicine has been limited by our inability to model how individual genetic variations affect drug metabolism, disease progression, and treatment response. Each person's unique genetic makeup creates a different biological environment that can dramatically alter how treatments work, but classical computers lack the power to model these individual differences accurately. Charles Liu, the astrophysicist, has explained that biological systems are fundamentally quantum mechanical, operating through processes that classical physics can describe, but classical computers cannot efficiently simulate. It's like trying to understand a symphony by analyzing individual notes. You miss the harmonies and interactions that create the actual music. Cancer treatment has been particularly challenging because cancer cells evolve and adapt to treatments, developing resistance through genetic mutations and metabolic changes. Traditional treatments often work initially but become ineffective as cancer cells find new ways to survive and proliferate. Neurological diseases like Alzheimer's, Parkinson's, and ALS have remained largely incurable because they involve complex protein misfolding and cellular dysfunction that we haven't been able to understand or correct with traditional approaches. But quantum medicine is addressing these fundamental limitations by enabling precise modeling of biological systems at the quantum level, opening new possibilities for understanding, diagnosing, and treating human disease. Quantum computers are revolutionizing drug discovery by enabling the simulation of molecular interactions with unprecedented accuracy and speed. These systems can model how potential drugs will interact with target proteins, predict side effects, and optimize molecular structures for maximum therapeutic benefit. The breakthrough comes from quantum algorithms that can simulate the quantum mechanical behavior of molecules directly rather than using classical approximations. This enables drug designers to understand exactly how potential treatments will work at the atomic level before any laboratory testing begins. Brian Greene, a theoretical physicist, has described quantum drug discovery as using quantum computers to explore the space of all possible molecular interactions, finding therapeutic combinations that classical chemistry could never predict. We're not just discovering drugs faster, we're discovering drugs that work through mechanisms that were previously invisible. Quantum-designed drugs are showing remarkable success in early trials. Cancer treatments designed through quantum simulation are achieving response rates that exceed traditional chemotherapy while causing fewer side effects. These drugs are designed to target specific molecular pathways that are unique to cancer cells, leaving healthy cells unharmed. Alzheimer's disease, which has resisted treatment for decades, has been addressed through quantum-designed drugs that can cross the blood-brain barrier and target the specific protein aggregations that cause neurodegeneration. Early results suggest these treatments can not only halt disease progression, but potentially reverse cognitive decline. Rare genetic diseases that affect only small populations are benefiting from quantum drug design because these systems can create personalized treatments for individual patients. Quantum computers can design drugs specifically for a patient's unique genetic mutation, enabling treatments for diseases that would never be profitable for traditional pharmaceutical development. The speed of quantum drug discovery is also revolutionary. While traditional drug development takes over a decade, quantum-designed drugs are moving from concept to clinical trials in 2 to 3 years. This acceleration could save millions of lives by bringing effective treatments to patients much sooner. Quantum computers are enabling truly personalized medicine by modeling how individual genetic variations, environmental factors, and lifestyle choices affect disease risk and treatment response. This enables the development of treatment plans that are optimized for each patient's unique biological profile. Pharmacogenomics, the study of how genetic variations affect drug response, is being revolutionized by quantum analysis of individual genetic profiles. Quantum systems can predict how a patient will metabolize specific drugs, what dosages will be most effective, and which treatments are most likely to cause adverse reactions. Cancer treatment is becoming increasingly personalized through quantum analysis of tumor genetics. By sequencing a patient's tumor and modeling its molecular characteristics with quantum computers, oncologists can identify the most effective treatment combinations and predict how the cancer will respond to different therapies. Elon Musk has noted that quantum medicine is like having a molecular scale understanding of each individual patient. Neuralink and other companies are developing quantum-enhanced medical devices that can monitor and treat patients with precision that was impossible with traditional medicine. Mental health treatment is being transformed by quantum analysis of brain chemistry and neural network patterns. These systems can identify the specific neurotransmitter imbalances and neural connectivity patterns that contribute to depression, anxiety, and other mental health conditions, enabling targeted treatments that address root causes rather than just symptoms. Preventive medicine is being revolutionized by quantum analysis of genetic risk factors, environmental exposures, and lifestyle patterns. These systems can predict disease risk decades before symptoms appear, enabling interventions that prevent diseases from developing rather than treating them after they occur. Organ transplantation is benefiting from quantum optimization of tissue matching and immunosuppression protocols. Quantum systems can predict transplant compatibility and design personalized immunosuppression regimens that minimize rejection risk while reducing side effects. Quantum sensors and imaging systems are revolutionizing medical diagnostics by enabling the detection of diseases at the molecular level, often before symptoms appear. These quantum-enhanced diagnostic tools can identify cancer cells, infectious agents, and metabolic abnormalities with sensitivity that exceeds traditional methods by orders of magnitude. Quantum MRI systems can image biological processes in real time at the cellular level, enabling doctors to watch diseases develop and treatments work with unprecedented detail. These systems can detect single cancer cells, monitor drug delivery to specific tissues, and visualize molecular processes that were previously invisible. Quantum-enhanced CT scans can create three-dimensional images of the body with resolution that approaches the cellular level while using much lower radiation doses than traditional CT systems. This enables safer, more frequent monitoring of disease progression and treatment response. Jana Levin, the cosmologist, has observed that quantum medical imaging is like giving doctors quantum vision that can see into the molecular machinery of life. We're not just taking pictures of anatomy, we're watching the quantum processes that determine health and disease in real time. Blood analysis is being revolutionized by quantum sensors that can detect individual disease biomarkers, genetic mutations, and metabolic abnormalities from tiny blood samples. These quantum diagnostic systems can identify diseases like cancer, Alzheimer's, and heart disease years before traditional tests would detect them. Surgical applications of quantum imaging are enabling procedures with precision that was previously impossible. Quantum-enhanced surgical systems can identify tumor boundaries at the cellular level, guide instruments with sub-millimeter accuracy, and monitor tissue health in real time during operations. Early disease detection is being transformed by quantum sensors that can identify the molecular signatures of diseases before any symptoms appear. This enables interventions that can prevent diseases from progressing or cure them when they're most treatable. Quantum medicine is enabling treatments that seemed impossible just years ago, including cures for previously incurable diseases and therapies that can reverse aging and regenerate damaged tissues. Gene therapy is being revolutionized by quantum-designed delivery systems that can target specific cells and tissues with unprecedented precision. These quantum-enhanced gene therapies can correct genetic defects, replace damaged genes, and reprogram cells to fight diseases like cancer and autoimmune disorders. Regenerative medicine is benefiting from quantum optimization of stem cell therapies and tissue engineering. Quantum systems can design scaffolds and growth factors that guide tissue regeneration with precision that enables the replacement of damaged organs and tissues. Aging research is being transformed by quantum analysis of cellular aging processes and the development of treatments that can reverse age-related damage at the molecular level. Early results suggest that quantum-designed anti-aging therapies could extend healthy human lifespan significantly. Immunotherapy is being enhanced by quantum design of treatments that can reprogram the immune system to fight cancer, autoimmune diseases, and infectious diseases more effectively. These quantum-enhanced immunotherapies are showing remarkable success in treating previously incurable cancers. The quantum medicine revolution represents more than just better treatments. It's the foundation for a future where human health and longevity are limited only by our understanding of biology, not by the constraints of traditional medicine. We're We're approaching an era where aging, genetic diseases, and even cancer could become problems of the past. Thank you for joining us on Click Future, where your future is a click away. Next, we'll explore how quantum computers are solving the climate crisis, enabling technologies and solutions that could reverse global warming and restore planetary health. The quantum revolution is our most powerful tool for healing both human bodies and the Earth itself. What are your thoughts on quantum medicine? Are you hopeful about the potential for curing incurable diseases? Let me know in the comments below, and don't forget to subscribe for more insights into the quantum technologies that are transforming human health and planetary well-being.